Hi, this is Dr. Karitzis. I'm one of the sports medicine physicians with Ortho Virginia, down here in Richmond, Virginia, Midlothian at the St. Francis Hospital. Today we're going to discuss the throwing shoulder, and specifically we're going to discuss a disorder called GIRD. It's called the glenohumeral internal rotation deficit. So, what is GIRD? Well, in throwers, what we find is that unfortunately their shoulder makes changes as they throw more and more. The shoulder adapts to throwing. What happens in the throwing shoulder is the shoulder begins to gain more motion going back, and many of you may have seen videos where the pitcher's arm is parallel to the ground way back. Well, as they lose that motion, as they gain this motion, they lose this motion. And so they get an internal rotation, which is this way. They get an internal rotation deficit. So, unfortunately, there's a spectrum of problems that can come with that. The initial thing that we begin to see is pain and discomfort with throwing, and then throwers will start to short arm it. Well, they won't finish their throw. They'll kind of try to cut it off because it hurts for them to allow their arm to finish and follow through. With more severe glenohumeral internal rotation deficits, it can lead to other problems in the shoulder, including labral tear. So we want to make the accurate diagnosis for this problem, and then we want to treat it correctly. So the first thing we'll do is do a really good physical exam on the throwing shoulder and assess the difference in rotation between the throwing arm and the other arm. And what we typically find is there's at least a 15 to 20 degree difference in the internal rotation. They lose this. So this is less, and this will be a lot more. And so when we see that internal rotation deficit, typically what we will do is initiate a non-surgical treatment plan that includes physical therapy to help regain the motion. We'll institute a home stretching program that needs to be done religiously several times a day. And then also place them on physical therapy, on anti-inflammatories, and then shut them down from throwing for a little bit. This works in greater than 90% of athletes. So it's an outstanding way to treat this. Throwers will get better, and they'll be able to get back to throwing again at the same velocity that they were without pain. But it takes a while. It can take several weeks to get it better. One of the stretches that we do is a stretch called a sleeper stretch, and we'll have you lay on your side, and we use the other arm and bring it, use it to turn this down. You would typically, when we demonstrate this in the office, you can see a significant difference between the non-throwing arm and the throwing arm. And for every 1 centimeter of difference from the table that the arm doesn't rotate down, it's about a 4 degree difference in rotation of the shoulder. So as we have our patients start working through gaining this internal rotation and working through these sleeper stretches, then they will also, their shoulder will begin to feel better. The sleeper stretches hurt at first, but over time, things settle down. We also will have them work a little bit on bringing the arm across their body as well. That will help stretch out the back of the shoulder as well. So what we're trying to do is stretch out the back of the shoulder so that they have room for their arm to follow through in their throwing motion. And then that typically improves their symptoms and they get better. And again, 90% get better. Unfortunately, sometimes we see patients, I'll see patients for second opinions that have GIRD, and they end up being told that they have a different diagnosis, and some patients even end up with surgery, labral repairs, rotator cuff debridements. We've seen all kinds of things, and really what they needed was the correct diagnosis made and the correct treatment made. At Ortho Virginia, we have a network of sports medicine physicians throughout the state that are trained to be able to diagnose and treat these types of problems that are a little bit more complex than basic issues. And we're happy to be able to take care of these problems for you. Our sports medicine network at Ortho Virginia has physicians that have taken care of teams on the high school, collegiate, and professional level. I'm one of the team physicians for the University of Richmond, and I'm also the head orthopedic physician for the Richmond Kickers professional soccer team. I've had a lot of experience taking care of these types of issues, And I look forward to helping you with this problem, or helping your young athlete or your family member, as do all of our physicians. We're happy to see you and help you take care of this issue. So reach out to us. You can reach us on our website at orthovirginia.com. I can be reached on my website at kneeandshouldersurgery.com or at the St. Francis office. Thank you for listening, and I hope you have a wonderful day, and I hope this is helpful.